This is a pretty exciting day for me. I'm introducing the new patented Stanton symmetric oval buttock implant. The reason that this is going to be revolutionary for the world of buttock implantation and augmentation is because up to today we've only had two implant shapes available. We've had the teardrop oval and the traditional round. These are both great implants. They've served us really well. However, the problem is about 80% of women or patients have more of an oval or ovoid shaped buttock cheek. Therefore, this implant fits in there best from top to bottom. The problem with this implant has been that there's about a 20-25% or so chance or risk of rotation 180 degrees clockwise or counterclockwise. When that happens, this heavily weighted bottom part suddenly is at the top. You can see from the side how it looks compared to this as well. That looks different, feels different to patients, and of course is very frustrating. Because of that reason alone, a lot of patients choose to go with the round implant that even if it does rotate, which it will, it doesn't matter. It's symmetrically round from this direction as well as from the side. It looks the same. That can be a problem because the buttock cheek on those patients is longer and more narrow, and as you can see, the problem is the top of the implant always has to be at the same position. In this case with the round, and a patient that should have gone with the oval shape, there's a step off at the bottom where their buttock continues where otherwise their oval implant would have taken care of that part and ended much more naturally into the back of the thigh. That's a big problem, especially when patients are in different positions, especially like bending over. The bottom of the implant is more noticeable, as well as the side of the implant can peek out beyond the edge of the gluteus maximus muscle. So after years of dealing with that issue, trying to convince patients that in this world of plastic and cosmetic surgery, our first and foremost, other than safety, intentions is always to create a beautiful result. Yet, because of the concern of rotation, patients would go with the round. So after working on different designs for about a year, I came up with a combination of the two, and basically I put these two implants together, giving the patient the length of the teardrop oval implant, so it starts and ends more naturally, but the middle projection of the round implant and the rotational issue of the round implant, whereas this implant, you can see, is symmetrically oval or ovoid. If it rotates 180 degrees clockwise or counterclockwise, it's a non-issue. It's going to look the same because there is no top or bottom to this implant, just like the round implant, no top or bottom. So we're going to use this today for the first time. I guess from that standpoint it will be experimental, but I have full 100% confidence after doing thousands of these that this is going to be the best of both worlds here and give a maximum point of projection a little bit higher up, like patients like, give the length that's needed for the buttock cheek, and also not be too wide over here so that it doesn't poke out or peek beyond the edge of the gluteus maximus muscle. Now I'm going to bring in the patient and show you with the implant up to her buttock cheek the differences and why this is going to be the best. So we have a 22-year-old female patient here in the preoperative marking area for buttock augmentation with implants today. She's the most lucky patient to be experiencing for the first time the new patented Stanton symmetric oval implant. And I'm going to explain briefly why that implant is going to be best for her and why 80% of the patients are going to benefit from this implant, because 80% of women have more of an oval or ovoid buttock cheek as opposed to a round. And I'm going to lay these existing implants up to the buttock and show you what the pluses and minuses are of the traditional implants and then the new Stanton implant. So first we determined what buttock implant to use, size and shape, by just taking some simple measurements. Find the crest of the bone back here and then measure from that down, and she's about nearly 17 centimeters. And then we go about an inch in from the buttock crack basically and measure out, and she's about 12 11 and a half, 12 centimeters from the gluteal depression here. This is basically where the gluteus maximus muscle is ending, so we don't want to go too far beyond that. Otherwise, the implant will peek through there, especially when the patient is bending over. So, based on her dimensions, 16 and a half centimeters by only about 12, she has an oval buttock cheek. Therefore, traditionally, we'd use the teardrop oval implant so that the takeoff of the implant from the lower back and its ending point into the back of the thigh here is most harmonious. It takes up the right length, the right width. The start and stop it blends in even when the patient is bending over. However, as explained earlier, this implant has a major problem in that it can rotate 20+% of the time and go from this to this, and you can imagine how the patient feels when that happens. Because of that reason, a lot of patients will choose the round because when it rotates, it doesn't matter. It looks the same. However, the round in this case, the implant always has to be positioned at the top part of the buttock cheek, and it comes off the lower back, gives a significant or severe projection or swoop, which a lot of patients like, and I don't blame them, that's what they come in for. But now here the implant's ending way too soon on the buttock cheek, and this part of the butt continues on like you have a double bubble almost. You have the gumdrop effect of the round implant up top, and then you have the native existing buttock cheek that still continues thereafter. Also, this implant, it tends to be too wide for most patients, and it pokes out beyond the edge of the muscle and can be palpable or grabbed sometimes, or especially in positional changes, much more visible. So, to remedy both problems and to combine the best of both worlds, or both implants in this case, created the symmetric Stanton, or the Stanton symmetric oval implant. For the most purposes, I'm going to refer to it as the ovoid implant from now. And this combined the round implant with the rotational issue, no top and bottom if you will. You can see from the side, no top and bottom. And the teardrop oval implant in that it has the right length and the width to fit this patient. Again, here's her iliac crest bone, and this is the ending, and it fits in there much more harmoniously, moves the point of maximum projection up higher, which a lot of patients love, and is not too wide, doesn't poke out beyond the edge of the gluteus maximus muscle. So we're now going to proceed into the operating room and put this implant in for the very first time.